Hepatic encephalopathy. So this condition is a complication of either acute or chronic liver disease, and it presents with disordered central nervous system function due to inability of the liver to detoxify ammonia and other chemicals. So the causes include viral hepatitis, alcoholic hepatitis, cirrhosis of the liver, hepatocellular carcinoma, drugs like halothane, isoniazid, paracetamol overdose, herbal preparations, fatty liver of pregnancy. Precipitating factors in a patient with pre-existing liver disease include fever, hypotension, infection, fluid and electrolyte imbalance, excessive use of loop diuretics, sedatives, increased gastrointestinal tract protein load, for example, heavy gastrointestinal tract bleeding, alcoholic binge. Symptoms are jaundice, confusion, disturbed consciousness, which leads to disordered sleep pattern, hypersomnia, and inversion of sleep rhythm, apathy, and eventually coma, and also personality changes. Signs that are usually elicited include cyanosis, fetal hepaticus, signs of chronic liver disease, and neurological abnormalities like speech impairment, hysterexis, that's a flapping tremor, which indicates pre-coma and strongly supports the diagnosis of encephalopathy. Also, inability to draw or construct objects, for example, a 5-pointed star, incoordination, lethargy, and also encephalopathy, which are in 4 grades. Grade 1, mild confusion, irritable, tremor, restless. As grade 2, lethargic responses, decreased inhibitions, disorientation, agitation, hysteresis. And grade 3, stuporous but arousable, aggressive bursts, inarticulate speech, and marked confusion. And grade 4, coma. So investigations include FBC, that's full blood count, blood glucose, liver function test, blood urea and electrolytes, hepatitis B surface antigen, hepatitis C screening, prothrombin time, as INR, in infection screening, blood culture, urine RE, chest X-ray, diagnostic ascitic tap. The treatment objectives are to identify and correct precipitating factors promptly and to treat underlying cause of the liver disease. Non-pharmacological treatments: place in the coma position if unconscious, maintain fluid and electrolyte balance, avoid dehydration and electrolyte abnormalities such as hypokalemia, monitor temperature, pulse and respiratory rates, blood pressure, pupils, urine output and blood glucose regularly. Avoid alcohol, paracetamol and other hepatotoxic agents. Avoid sedatives such as benzodiazepines and drugs that impair coagulation system. Also, patients should not have their protein intake restricted. Maintain an adequate protein intake of 1.2 to 1.5 grams per kilogram per day. Encourage intake of high carbohydrates diets by mouth or NG tube. Pharmacological treatment: measures to correct hydration status and nutrition. For adults, give dextrose saline, 5 to 10% dextrose in 0.9% saline, that's IV, 500 milliliters 8 hourly, according to requirements. And high potency vitamin B IV, as formulated as 2 separate vials, one pair of vials daily, added to glucose IV infusion or solution. And in children, dextrose saline as 4.3% in 0.18% saline IV, and you add high potency vitamin B IV, formulated as 2 separate vials. And measures to lower blood ammonia concentration. First line treatment, we give lactulose oral. In adults, start with 30 to 45 milliliters as 20 to 30 grams, 6 to 12 hourly. Review dose to maintain 2 to 3 semi-solid stools per day. And in children and adolescents, start with 5 to 20 milliliters, 6 to 12 hourly. And review dose to maintain 2 to 3 semi-solid stools per day. In neonates, start with 0.5 to 5 milliliters, 6 to 12 hourly. And this to review dose to maintain 2 to 3 semi-solid stools per day. Or lactulose rectal as 300 milliliters dilution in 700 milliliters water via rectal balloon catheter, 4 to 6 hourly, and retain in rectum for 30 to 60 minutes. And review dose to maintain 2 to 3 semi-solid stools per day. And also in adults, add metronidazole oral, 400 milligrams 8 hourly. And children, 15 milligrams per kilogram 12 hourly. And neonates with weight greater than 2 kilograms, give 15 milligrams per kilogram 12 hourly. And from 1 to 2 kilograms, we give 7.5 milligrams per kilogram 12 hourly. Second line treatment, you give regimen oral in adults, 550 milligrams 12 hourly, and in children aged more than 12 years, you give 200 milligrams 8 hourly. Less than 12 years is not recommended. Hepatic encephalopathy associated with active bleeding, as when INR is greater than 1.5 or platelet count is less than 50 times 10 raised to the power 9 per liter. So adults and children, so lies with hematology. So you could give fresh frozen plasma IV for INR greater than 1.5 or platelets concentrate IV as platelet counts less than 50 times 10 raised to the power 9 per liter. Antibiotic prophylaxis in hepatic encephalopathy associated with cirrhosis and upper gastrointestinal hemorrhage. In patients in whom oral administration is not possible, you give ciprofloxacin IV in adults, 400 milligrams 8 to 12 hourly. Is administered over 60 minutes. Or ceftriaxone IV 1 gram daily for 7 days. Or ciprofloxacin oral 500 milligrams 12 hourly. Or norfloxacin oral 400 milligrams 12 hourly for 7 days. Hepatic encephalopathy precipitated by bacterial infection. First line treatment, you give ciprofloxacin IV 400 milligrams 8 to 12 hourly for 2 days to be administered over 60 minutes, and then you give ciprofloxacin oral 500 milligrams 12 hourly for 5 days. Second line treatment, you give cefotaxime IV 2 grams 8 hourly for 7 days, or ceftriaxone IV 2 grams daily for 7 days. Referral criteria, we refer patients if the condition does not improve, and all children with hepatic encephalopathy must be referred to a specialist.